When I started, we had 3 programs, which was the chronic disease self-management program, the diabetes self-management program on the community side, and we had the healthcare provider program, which was choices and changes. Today, sitting at 15 programs, 20 peer facilitators that were trained, that's 2012. And today we have 90. So these are people with lived experience of chronic disease, chronic pain.
The interactions of these symptoms in turn make our pain condition worse. It becomes a vicious cycle that only gets worse unless we find a way to break the cycle.
So everything that we do in the program is an evidence-based program. So those are very fancy words to basically say that if people attend this program, their ability to understand that they have a role in their disease management increases. Quality of life improves. Us then thinking, okay, let's bring in a new program and let's offer the service is never just based on a whim. It's always guided by good practice, good evidence, and there is a lot of time spent building also that capacity in the people that get trained. Peer-based programming is important, but I think that the connection, the empathy that exists in saying, you know what, you don't have to tell me your full story, but I get it.
So I actually don't see it as teaching, I see it as peer leading. So I'm kind of guiding people on a similar journey that I went on, and I learn a lot from the people that participate in the groups and the people that I co-facilitate with. I have chronic pain, I have a spinal cord injury. So I sustained a spinal cord injury when I was really young, and it was a really isolating experience, and I kind of pretended like I wanted to live my life with this invisible disability without anyone seeing it. It developed the community I already had and then also brought me to a new one, which I think was really special. Most people are here to find something outside of the healthcare system that works for them, but it's important to have a holistic approach to understanding how to manage pain better. It's a really powerful community that we have built here. It's strong and supportive and able, which is really impactful.
This is the first caregivers program that we've been to. The most useful part for me is having the experience that I'm going through as a caregiver validated through shared experiences. It's actually calmed me down. For those of us who have older people in our lives, like eventually you're going to need at least one of the tools.
It's family. They took care of us when we were there, we have to take care of them.
When people show up at the Art Gallery of Ontario and there is this person greeting them in a red t-shirt saying South Riverdale Community Health Center, what they are saying is, you know what, I feel like I belong because that person looks or feels like me.
The program partnership with the South Riverdale Community Health Center has been really incredible for the Art Gallery of Ontario. It's actually facilitated making relationships with community members who might not necessarily have originally seen themselves at the AGO. The society, as it's shifting, there's significant paradigm shifts all over the place. It's more and more important for us to find ways to care for ourselves, care for others, and connect with others. I think art for me is such an incredible way to understand the past, you can almost understand the present and look to the future as well, and that's important.
When I stop to think about the core program, there are 800 people benefiting from this work. That's 800 stories. The ripple effects of that are immense, because people talk to people, and that's the word of mouth story of this work. It is people saying, hey, I attended this, you should go attend it because you're gonna learn to take care of yourself, or you're gonna learn how to take care of your patients or clients. I haven't had to promote this program. It just happened organically, and that's wonderful.